Welcome, everybody. We're so delighted that you joined us today for the Inclusive Education and Early Childhood Community of Practice. My name is Jennifer Rigg. I serve as the Executive Director at the Global Campaign for Education-US and one of the organizers of the Collaborative Community of Practice. We are so delighted that you're all here today. We have such a fantastic discussion with thanks to all of the presenters who are joining from around the globe. And if you haven't had a chance to already, please share your introductions in the chat box. We're so grateful to Stephanie Pena, who's moderating the chat box and helped organize this conversation today. Krista Giesica and Karina Anton Lopez with the GCE-US team are all working hard behind the scenes. So we're grateful to all of you for making this possible. And with that, we're really excited to bring a fantastic discussion on a variety of topics. It's been an extremely busy time since our last community of practice session. So we want to hear from all of you about your updates, your ideas as we're planning things together. December, of course, brings International Day of Persons with Disabilities. There's the International Day of the Girl in just a few days. So lots of opportunities to highlight the work and try to accelerate progress. Many people are coming off of the UN Transforming Education Summit, which we'll hear a little bit about later as well. So please don't be shy. Please share your ideas, topics that you'd like to include in future community of practice sessions. And as Stephanie is sharing as well, if you or your partners are interested in joining the community of practice, it's open and welcome to everybody. So we'll also share the link where it's easy to sign up, so you'll get alerts for future conversations as well. So with that, we're really delighted to be able to kick off our discussion with hearing from Stuart Cameron with the Global Partnership for Education, presenting GPE's Disability Household Survey and some of the exciting work that they're doing on disability inclusive education. Many of you already know Stuart Cameron. He's the thematic lead on equity and inclusion and an education specialist at the Secretariat of the Global Partnership for Education, otherwise known as GPE. Prior to joining GPE, he worked at Oxford Policy Management, was a research fellow at UNICEF's Office of Research, and was part of UNESCO's Global Education Monitoring Report team. His work throughout his career has focused on policy analysis and research on education, especially for marginalized groups in developing countries, and he holds a doctorate in education from the University of Sussex. So we're really thrilled that Stuart is leading the charge at GPE on improving inclusion and disability inclusive education and equity. And so with that, we'd like to move to the next slide and hand it over to Stuart to share the latest on disability data in GPE partner countries. Thanks for joining us today, Stuart. Over to you.
Hi, everyone, and many thanks to GC for inviting me to present this work. This is a somewhat straightforward paper where we were basically checking the extent to which GPE's partner countries have data on disability available from household survey sources. So if we go to the first slide, I would hope many of you are familiar already with the Global Partnership for Education, but some may not be. GPE is the world's only partnership and fund which is entirely dedicated to education in lower income countries. And we leverage global and national resources for education for the poorest and most vulnerable children. Next slide, please. We recently had a couple of years ago, had a process of developing a new strategy. And out of that, our vision and mission, our vision is a quality education for every child. And our mission is to mobilize partnerships and investments that transform education systems in developing countries, leaving no one behind. Next slide, please. So here you can see kind of the scope of how we work. Partner countries are those which have already started the process of applying for funding through GPE. Those are the ones in green on this map. And there are over 70 partner countries. There are also a number of other countries which are eligible for GPE funding, but which are not currently receiving grants from us. Next slide, please. So why did we start on this paper about household survey data on disability? Well, GPE has a global level results framework, which includes some standard indicators such as the rate of out-of-school children and the rate of completion of primary and lower secondary school. And we use these to track the overall progress in education of GPE's partner countries. We, as part of our results framework, aim to report on these statistics disaggregated by disability status, so that you can see, for example, what percentage of children with disabilities are out of school at primary or lower secondary level. And also would be able to look, for example, at learning outcomes ideally, and to understand to what extent children with disabilities are learning, as well as many other measures of, around educational progress, which would be essential for countries' own planning. So it's important both for the kind of global level, understanding how sets of countries are progressing as a whole, and for within countries to do their own planning of inclusive education policy, to understand to what extent children with disabilities are being included in schools or not. Now, GPE already has, for a long time, has been supporting a lot of work around MS, that's Education Management Information Systems. Now, MS usually means surveys of schools where they ask the principal or head teacher of the school, or sometimes individual teachers within the school, questions around their students. And that can, for example, by asking the head teacher or teacher about how many children in their class have disabilities, they could hope to gather information on the enrollment of children with disabilities in those schools. However, it's not entirely clear, and there continue to be ongoing studies on this, to what extent this is an accurate measure of disability when you ask head teachers or teachers about individual students, because if they're managing a large school, they may not have that information. They may not be well placed to assess it. And the other problem with school surveys is that you also need to know about out-of-school children. School surveys typically only tell you about the children who are in school, by definition. You need to know how many children there are with disabilities in the population as a whole, so that you can calculate how many children are out of school. And school surveys don't provide that. So what are the problems? Firstly, the data may not be collected at all. Often there are a number of countries, as we're about to see, that don't have household surveys and may not be even attempting to collect disability data in their school surveys. Surveys are infrequent. At most, they're typically every 5 years, but often in some countries, they are less than that. And they're collected in sort of bad, inconsistent, and sometimes derogatory ways. And I had pasted a slightly older survey to show the types of problems with how disability was sometimes measured in household surveys. This is a case, and I'm not going to name the country, but their question is, do you suffer from a chronic disability? Yes or no? And then a number of categories for disability, including deformities at birth, hearing, manipulation, mobility, polio, problems of speaking and seeing, and a slot for other as well. And the problem with that kind of questioning, first of all, is that it kind of mixes up a number of medical and let's say sort of broader impairment categories in a way which is unclear and potentially confusing. Not likely, it's also not standardized, so it's not likely to lead to good, consistent measurement of disability in a way which can be understood across countries. Next slide, please. So in step with the broader change in understanding around disability that started to happen really quite a long time ago, I mean, several decades ago, there was a shift from the medical model to the social model. The medical model involving an understanding of disability as impairment directly caused by disease or injury, which require prevention or medical intervention. And the way you would label or categorize that disability when it comes to a survey is to label it as a medical disorder and collect data on it as part of a broader module on health. That has shifted towards a social model understanding of disability, where disability is understood as involving the relationship between the individual and their environment in terms of limitations or barriers in performing their daily activities and restrictions, and in their social participation. Disability, the response to disability is seen as requiring changes in the environment, attitudes, and assistance. In other words, inclusion of people with disabilities. And when it comes to data collection in household surveys, that means a shift towards data on functionings, that is what the person can do in their daily life with or without assistance that may be available to them. Next slide, please. So the Washington Group on Disability Statistics is one of the main bodies that's been developing better household survey instruments to collect data, which is in line with this social model of disability. This is showing briefly what the Washington Group short set of questions look like. This was designed to be a deliberately brief set of questions which could be administered quickly as part of a much longer survey without having too much of an adverse effect on survey length. Survey specialists are often very concerned to keep surveys short because the household surveys, which are generally administered in developing countries, are already extremely long, and it's known to have an adverse effect on data quality because people basically become fatigued from answering questions for so long and stop thinking about their answers or stop bothering to provide accurate answers. So the Washington Group short set focuses on 6 types of impairment: seeing, hearing, walking or climbing steps, remembering or concentrating, self-care such as washing or dressing, and communicating or being understood by others. And under each question, they have 4 response categories. So it's not just yes or no. It's no, I don't have any difficulty. Yes, I have some difficulty. Yes, I have a lot of difficulty, or I can't do it at all. And this is typically addressed to the individual themselves, but in the case of children, may be addressed to the parent or primary caregiver. Next slide, please. The Washington Group on Disability Statistics, together with UNICEF, also developed a longer module called the Child Functioning Module, in which the primary caregiver responds on behalf of the child. There are some tweaks to the question design. And as in the Washington Group short set, there are questions around vision, hearing, walking, remembering, concentrating, self-care, and communication. Additionally, there are separate modules for 2 to 4-year-old children with slightly different questions, and they ask in particular around dexterity, play, and controlling behavior. And a separate module for 5 to 17-year-old children, which includes questions around accepting change, controlling behaviors, making friends, and anxiety and depression. And this module has been used mainly in UNICEF's multiple indicator cluster surveys, which have been administered in a large number of low and middle income countries. Next slide, please. So we tried, first of all, the number of surveys conducted in GPE's partner countries by year, and the type of disability module that was used there. So the green bars in this chart are other ones, other than the 2 types of module I've just mentioned. The dark blue is the Washington Group short set, and the light blue is the Child Functioning module. So you can see that from 2017 onwards, UNICEF in particular rolled out the child functioning module in a large number of surveys. At the same time, the use of other modules, which are often not as well designed and not necessarily consistent across countries, and maybe not consistent with the social model of disability, have been phased out and kind of disappear altogether. We don't really see countries using those anymore as of 2018. There's a question mark on 2020 here because it may be that some surveys have been conducted but which were not yet where the information about them has not yet been published, so we haven't been picked up on them. We also are not entirely clear to what extent countries' data collection ground to a halt as a result of the COVID-19 pandemic. Next slide, please. So out of the 76 GP partner countries at the time of this study, there were 22 countries for which we could not find any good household survey data which had disability modules using the Washington Group short set or the child functioning module. That doesn't mean absolutely that data doesn't exist, because sometimes it's hard to find that, but we checked a number of sources. And we also cross-checked this data with GPs country leads to see if there was data that country partners were aware of. And we are talking here about, because the scope for this study was to look at data from 2010 to 2020. So during that period, there seems to be no surveys with good disability data for those 22 countries. There were a further 6 countries which do have data of some kind for this period, but where it's not reliable and comparable, by which I mean that they didn't use the Washington Group short set or the child functioning module. Next slide, please. So countries have been conducting a number of different types of survey. You can see the most common of these, they've been conducting mixed surveys, followed by the DHS surveys, which are the demographic and health surveys conducted with support from USAID across a number of countries. 10 of them had censuses with disability inclusion modules. 6 of them had living standards measurement surveys, which are typically supported by the World Bank. And 16 had other types of survey. So if you go to the next slide, it should show some labels on this slide. Yeah, that's good. Yeah, DHS, as I mentioned, is usually supported by USAID. Mix is always supported by UNICEF. The censuses with disability modules were often in Pacific Islands and supported by the Pacific community, along with other donors sometimes. While other types of survey often have World Bank technical support and sometimes financial support. Next slide, please. So we made a number of recommendations for how this situation can be improved and how more countries can have data on, can have good household survey data in order to assess the number of children who are excluded from school and who have disabilities. The first, and these were really targeting global partners, including international organizations and donors. There might be a slightly different set of recommendations which would be focused on developing country partner governments, which would basically be to consider having more of these surveys and to making use of them. But at the global level, there are really kind of four recommendations. The first one is to monitor disability data availability. So as we've been doing with this report, monitor how many countries have this disability data available in order to raise awareness around the need for more and better data. Secondly, to advocate for more household surveys and censuses which have one of these standard disability modules, especially in those countries like the 22 I listed, which don't currently have any nationally representative and comparable sources. And it's important to mention that disability disaggregated data is also required for the Sustainable Development Goals monitoring. But in most countries, there are actually very few countries that have a baseline for things like the rate of out-of-school children disaggregated by disability status from close to the beginning of the SDG period in 2015. That's going to make it very hard for us ever to understand the extent to which the SDG on education is actually being met for children with disabilities, or if children with disabilities have been left behind from the SDG process, from the SDG movement. The third recommendation is to support analysis of globally comparable disability disaggregated statistics. So even where these data sets are available and the household surveys have been conducted, the analysis of them so far that's been published has been relatively limited. However, on the last slide, I am going to list the number of studies which do this for subsets of countries. A fourth recommendation is to support citizen-led assessment organizations such as the PAL Network and ASA Pakistan, which is also part of the PAL Network. These are organizations which have conducted learning assessments on a large scale across a number of countries. And typically the assessment is conducted by local members of communities. And the primary aim of these is to understand how much children are learning, but they also include questions on whether children are attending school or not. So they give us quite rich data, both on whether children are accessing school and whether they're learning in school. ASA Pakistan and its partners in particular have included standard disability modules for children, which allows them to disaggregate their results by disability status. This plays a really important role in complementing these household surveys and helping to hold governments to account. So thank you. There's one more slide, which is a list of links. So this is just to highlight that there are already a number of reports using these household surveys that have been conducted. We have the slides. I think the slides have been posted, so you can click on these links to find out more about the findings of these studies. So thanks very much. I'll be happy. I can see there's some questions already, and I'll be happy to have a look and answer them.
Thank you so much. That's wonderful. We really appreciate all that you're doing and sharing, Stuart. We realize it's a challenge across countries, but this is absolutely, the right time. Well, the right time would have been, previously, but let's speed up this process as fast as we can on behalf of children and youth, teachers, caregivers, parents around the world with disabilities, so that, we know that the data is just so critical. Absolutely. So there are a few questions that we'll kick off with, and welcome ideas, comments, discussion from everybody in the chat as well. Feel free to use the Zoom feature to raise your hand if you'd like to come in as well off of mute. So I believe the first question that came in was asking, thank you, Melissa, are there questions that address learning disabilities? Hassan asked, Stuart, in the modern disabilities language surveys, are we still including invisible chronic diseases such as HIV/AIDS? And Stephanie asked, many organizations are working towards making 100% of their education programming inclusive for learners with disabilities, such as USAID and World Bank and others, or increasing the amount of learners with disabilities reached, such as Education Cannot Wait's target to get to at least 10% of reach for children and youth with disabilities in their new strategic plan. One of the barriers has been around getting the data to support those efforts. What would your recommendations be for such organizations be? And then Stephanie also asked, which countries would you say are doing a good job, AKA could be used as a good example for collecting disability disaggregated data? And I'm so sorry, Stuart, maybe we'll just do the questions that we've heard so far. We have some time for discussion, which is great. Techwa with Sightsavers wonderfully reflected, great presentation, and asked, does GPE work in partnership with the Inclusive Data Charter to advance the availability of inclusive and disaggregated data in partner countries, particularly to strengthen support in the 22 countries mentioned? And Gulnar asks, how do you measure learning in the studies? And last one we've received so far is Evelyn asked, is there consideration for newborn screening to gain early intervention services and supports for families to foster integrated education systems and healthcare systems? Perhaps some of the data that you're seeing that comes out of support for health systems has that type of important cross-sectoral integration from birth onward. But Stuart, we'd love to hear your reflections and ideas, recognizing that we're all developing these answers together. So feel free to let us know how we can be helpful as well in moving this important work forward. Back to you, Stuart.
Yeah, thanks. Great set of questions. Let me try to take them in order. Questions that address learning disabilities, as we mentioned, they ask directly around ability to understand, concentrate, and to communicate. So those are the ways that they address learning disabilities, as opposed to, for example, trying to apply a more medicalized set of labels, such as dyslexia or autism, which in any case would not be possible for parents to assess within a household survey setting, unless they are in a country which has a good assessment system and they have already been assessed as having those disabilities. Yeah, there are, I mean, most of these surveys have broader health, well, maybe turning to the next question around HIV and AIDS. So most of those surveys have broader health modules. I think they nearly always do ask around HIV, ask questions around HIV and AIDS. I don't know the extent to which those questions are specifically asked for children, but the disability modules are very much focused on those set of impairments. So if you're interested, for example, in relationships between a medical condition and a particular impairment, then you could look at the correlation there in the studies, and you could also bring in educational variables to see if impairments which are associated statistically with a particular medical condition are also associated with, say, a higher risk of being out of school or of not learning. The question around making education inclusive, education programming inclusive, such as USAID and World Bank. GPE also has something on this in our strategic plan, that we will be monitoring the number of children with disabilities who are targeted by GPE funded programming. In our case, we're actually leaving it to GPE's grant agents. So GPE works through a number of grant agents within our partner countries, and it will be up to the grant agents to find a satisfactory for assessing the number of children with disabilities reached. I think in terms of recommendations, I mean, an obvious one will be to try and use preferably the child functioning module to understand how many children with disabilities are being reached. It's the most is kind of the most extensive and nuanced survey module designed specifically for children, and would probably be the best module to use in most cases. That said, it may not always be possible, and I think in some programs, agents are going to have to come up with a a potentially less precise but still defensible method of assessing numbers of children with disability who are reached. As for countries that are doing a good job, well, I think that, I mean, it may partly reflect the relatively small scale in which they have to do things, but a number of Pacific Island states have conducted recent censuses, which include full, extensive questions on disability status. To have a census with those questions is in some ways always preferable to having a sample survey, because it's going to provide more accurate and reliable data, which can be used in the longer term to understand what the population of children with disabilities is. And that's likely to be very useful for understanding these questions of educational exclusion in future. GPE has not been working with the Inclusive Data Charter. That's an interesting suggestion that I'd be happy to pursue further. I mean, we have been trying to understand ways that GPE could work towards increasing the availability of these household surveys. And a particular limitation for us is that GPE typically does work mainly within the education sector, although trying to work cross-sectorally on a number of issues, but not necessarily having as good links with national statistics offices, which are generally the lead part of governments in conducting household surveys. So I'm interested in that suggestion. It's something I'll look up, and if anyone wants to, if the person who made this suggestion, Takiwa, wants to provide any further information on that, I'll be happy to follow it up. How do you measure learning in the studies? Well, I don't have a comprehensive view of that, but UNICEF in particular added learning modules to its mix surveys. They focus on basic mathematical abilities using a number of questions, and basic literacy in the language, in I think the child's home language, and a number of questions there. So they're focused on kind of basic literacy and numeracy for the most part. But I don't have a very, the best place to look for that is to go onto the UNICEF Mix website, where they provide a lot of detail on their learning modules, which have been used in their latest surveys. Other surveys, as far as I'm aware, only have very brief questions around literacy and numeracy. Sometimes they ask the participant to read a short passage, and sometimes we'll ask 1 or 2 questions around comprehension of that passage. They're definitely designed to be sort of quick and simple measures of literacy and numeracy, rather than necessarily the most kind of in-depth and rigorous assessments of learning, which pedagogical experts might prefer to have, but you have to be kind of realistic about what they can do in this household survey setting. And then, is there consideration for newborn screening? I don't know if surveys are asking questions around newborn screening, but there's definitely the consideration of, if you look at the child functioning module, it's asking around impairments of 2 to 4-year-olds, which may already be a later age than you would want for some types of early assessment. It's not exactly the type of data which would guide at a micro level the provision of services, but it can provide overall guidance on the potential need for services at a national level, with perhaps some disaggregation by region or by, for example, income group. I think that covers all of them. I hope those are.
Thank you so much, Stuart. Really comprehensive. And Techua and others, please keep your, exactly. Catherine Tech shared some ideas about the ages and stages questionnaires, which have been used in the US context. if anybody knows about an answer to that great question about adaptation for international use to country and cultural context, let's keep the conversation going in the chat box. If that's all right with you, Stuart, thank you very much. And let us know how we can continue to help to share resources. We absolutely want GPE to be able to improve the data on in partnership with partner countries and communities. So this is such important work. Thank you very much for your presentation and for everything that you're doing. And we're really thrilled. I think this shifts us nicely into some tools for inclusive education, as we know that it's so critical to share what's working. And so we're really thrilled to be joined today by Alice Cavallazzi, and Stephanie Pena has kindly shared the full bios in the chat. Alice joined, is with Save the Children Italy as a senior education technical advisor. She holds an MA in pedagogy and a BA in education with a special focus on both vulnerable children and adults. And she has worked across NGOs, IOM, the Italian Agency for Development Cooperation, and AICS on domestic programs in Italy and across a variety of countries, including Kosovo, Ecuador, Albania, and Kenya. Her areas of expertise are education, formal and non-formal, and social inclusion. Thank you so much for joining us today and sharing your expertise on the inclusive education resources and toolkit that is just so important and so helpful as we grapple with ways to improve inclusive education for all children and youth. Over to you, Alice.
Thank you so much. So yeah, my name is Alice Cavallazzi, and I'm really thrilled about being here with you. Just to introduce you a little bit what we are talking about, the Inclusive Education Resources and Toolkit, it's a resource that has been developed within Save the Children Italy and Save the Children Sweden collaboration. If you kindly go to the next slide. Yeah, today I will just give you some information about the background, like the process, some info about how to use the toolkit, and some tips about what is going on in the next upcoming weeks, or actually months. Yeah, we can go to the next slide. And the next, thank you. So before to start with that, Save the Children, I don't know, I guess you are familiar, but I don't know how much you're familiar with the structure of Save the Children. So just a couple of informations. We do have internal also community of practices on inclusive education. Actually, I saw that one of my colleagues, she's one of the co-lead. She's there with us. She's here with us. Her name is Caroline Ellsbury, and the community of practice on inclusive education in 2017 created and defined a position paper about inclusive education. And actually this document has been recently revised. And I guess if it's possible, then I will share with you also the link of the position paper, which by the way, it's available also for externals. And we define, this is the definition that we have within our organization about inclusion, about inclusive education. So it's what in our understanding is one dimension of a right-based quality education, and which is emphasizing equity in access and participation, and responds positively to the individual learning needs. When we are doing our best within our organization in order to consider all the possible factors of exclusion. So for sure, for example, when it goes to disability, this is one of the factors of exclusion more unfortunately, than more often we face when we are working on the field. But of course, there are many other factors. So, for example, it might be related to ability, religion, nationality, or other characteristics. And so this is the purpose of working on a quality inclusive education, is in order to tackle and try to reduce those barriers for these potential categories. If we go to the next slide. Thank you. So now I will tell you a little bit more about the process. So how it came up that we, Save the Children Italy and Sweden, decided to develop an inclusive education resources and toolkit? Well, actually, the two organizations, which are, by the way, two members, at a certain point decided to develop something that could better respond to the needs of the family itself, because we realized, actually this was Italy first, we launched a survey within the movement asking, like, are you working on inclusive education, are you facing any, sorry for my microphone, maybe it's creating some rumors, but are you facing some problems, do you have everything you need in order to respond to the specific needs you are facing, and etc. So what came up is that actually, of course, we already had very good resources, but still we were facing, and we realized that there were some gaps. And there were some gaps not only in some areas of the intervention, but also in those areas like, for example, the teaching and learning area that basically we thought that we were good enough. But for example, there we realized again that, yeah, we were, but not that much. So people still need to be trained, still people really need to be a little bit led in order to identify the best resources to respond to the specific gap, to the specific need. So we also realized, for example, that social emotional learning in general was not something very within our within our implementation so well as enough inclusive. For example, people did not really know how to respond to specific needs. So this is how came up the entire idea. So if we go to the next slide, thank you. We decided then to join the forces together with Sweden. They had the same idea in mind. So we joined the forces and we worked really for more than 1.5 years together in order to develop this toolkit. Actually, I am one of the person who collab I was one of the co-leader of this process, and then we hired a consultancy firm that they created the toolkit. We also wanted the toolkit to be something like as much as possible an open source resource. So that is why we decided to upload it in a platform that is belongs to Save the Children, but it's open to everyone. Why? What was the idea behind? Is that we realized, first of all, that the more we collaborate with others and we also offer and share our knowledge, the best it is for the entire movement that works in inclusive education. And in the meanwhile, also because when we are on the field, we are working with partners and also with governments. So it's something that could be used differently and could help all the stakeholders that are working on inclusive education. And yeah, and please go to the next slide. Yeah, so basically what came up, we decided to make a real deep analysis, like a literature desk review of what we already had within the family, of what was available, also made by other organizations, and we made a selection. And then we decided also to develop some new tools in order to better respond to some specific needs, and we adapted some of existing tools. And yeah, so we also decided to keep quite an high attention also to the male components, because during the implementation of the programs, when it goes to learning, but also to the monitoring of the impact, for example, of the activities, not always we could guarantee such a I don't know, detailed response. So this is what we decided to create. If you go to the next slide, please. So you are not, I mean, I will not go in details, but this is just to show you a little bit the process, how it started. So as I was saying, we did collection data, the survey, the gap analysis, and then we try to involve as much as possible all the colleagues that are working both at regional offices, member offices, and on the field in order to get and to reach their, to get their feedback about it, to have as much as possible like the pulse of the situation. Maybe we found out that very nice resources have been developed maybe in some projects in some countries. So this is what we did, and we had this process several times, and then we finally had like official endorsement within our movement from what is called TLG. It's the technical leadership we have on education. Specific for education, it's called Learn. So this is how it started. As you can see, this is like a wheel, is like a continuous, in a continuous movement. Why? Because now, and I will show you in a few minutes, we're moving to the learning agenda, and then we will go under revision in 2023. Please, if you go to the next slide. So this is a little bit more a practical part. If you go to the next slide, I just want to show you, yeah, the next one, please. And the next one. There are too many transition slides, sorry. So before to go in details, there's something else I want to share with you. Again, I don't know, most probably some of you are already familiar with that, but allow me to just give you a couple of tips about it. This is the quality learning framework developed that belongs to Save the Children. Actually, this quality learning framework is under revision too, but this is like our best understanding of what does it mean to have a quality intervention on education and on learning. So as you can see, you can recognize there is also a social ecological model. We have the kid or the child at the center, and then we have different areas that are supporting the development. So it's not just about, when we have an intervention in education, it's not just about improving a lot the teachers. No, you need to work and make the best as possible in order to support all these different areas. And this is important to share also because we actually followed the structure of this quality learning framework in order to have it reflected within our in our toolkit. So just as a tip, when you will then go through autonomously through the toolkit, I hope so, you will see that, for example, the 5 foundation you have in the center, those are basically the chapters plus the access and policy and systems. And then the components within this slice of pie are the sub-chapters. So if you go to the next slide, this is maybe much, please. The next slide. Yeah, so this is the table of content. So maybe now it's easier to understand what I was referring to. So we have access, emotional and psychosocial protection, physical protection, teaching, parents, school leadership and management, policy, and then a meal. If you go to the next slide, yeah, so this now I will go a little bit in details about some components. If you go to the next slide, okay, so this all the chapters and actually all the sub-chapters do have a what if section. The what if section is like a little bit the core of the toolkit, is where you can identify and see like, oh, I do have this and that. I'm facing this and that problem on the field. How can I resolve it? I can't say resolve it. How can I address this gap or this need? So we have a what if where we identify the challenge. Then we have a key step. So it's like how to move forward in order to address that challenge. And then we have the tool we identified as the best solution, or our idea of the best solution in order to address that specific need. Then we have a description, and as you can see, we have tool users and tool beneficiaries icons, and this is something that should guide you also to understand if it's a resource that can be useful for maybe ACCD or a primary school or adolescents and etc. And also it depends if you are working on education in emergency or not. And then we have relevant indicators. So, and then I will show you what this code is referring to. If we go to the next slide. Yeah, and this is like, this is a section where we have, where we try to, and this session is at the end of each chapter, and is where we are focusing on various factors of exclusion, suggesting which tool might be used in order to face each particular challenge. So it's, well, I think to all of us is well known that, like, most probably when we are working on inclusion, there might be intersectional situations where maybe gender is an intersectional issue together with disability, or maybe it's about disability and stereotypes, or maybe related to COVID and disability, or I don't know, for example, financial barriers. So this is an additional section that I like really a lot, that helps to understand, maybe if I'm looking for a specific situation or condition, I might find the specific context in that section. If we move to the next one, yeah, and then yeah, to the relevant indicators, as I was saying, we also developed a menu of indicators. This is something actually Save the Children Italy did. And then we decided to use this menu of indicators in order to better support all of us working on education. And we identified the expected outcomes, the indicators, and we gave a code to each one. If we got to the next one, and this is like the further reading. I mean, actually, you can see that it's the further reading section. Again, it's at the end of each of the chapters. And it's interesting because, again, these are additional resources for users. And hopefully, I think some of these further readings might help some of us. Yeah, sorry, I think I'm late, so I'll go super fast to the next slide, just to give you, yeah, yes, please go to the next slide. And again, another one, yeah. So just, it will be shared with you where you can find the inclusive education resources in Toolkit. And as I said, this is an open source resource. Just for your information, there will be just few resources that belongs to Save the Children that have not been authorized. So in this case, you will see like SC staff only, but all the others are available to everyone. And if you go to the next slide, and I'm done, I guess. Can you move to the next one? Yeah, okay, this is important. Just please remind that each section is a kind of a standalone set of resources. We are not expecting anyone to read the entire toolkit. It's just something more interactive, where people will look for the resources and what they need. And if you go to the next one again, as I was saying, these are my next steps. Our next steps, we are piloting it. So we are collecting information and feedback. We are developing Arabic, French, and Spanish translations. Actually, French is already available. We are developing a video that we hope will help the people better understand how to use it. And we are developing a website and an app. Regarding the learning agenda, just please go to the next slide. Please, if you will have the opportunity to use the toolkit, please reach me for any suggestion, feedback, and etc., because these are so useful for us. We already know that we have some gaps, and as I was saying, the toolkit will go under revision. So the more feedback we receive, the better. So for whatever you want to share with me, please, I will share with you my email and just get in touch with me. Thank you so much.
Amazing. Thank you for all your work. And it's really exciting to hear about everything that's been underway, even since since you were a few months back starting to share about this. So real congratulations and kudos to everybody who's involved. Melissa asks, does the toolkit include addressing ableism and disability stigma? And I would just add another quick question. in terms of those next steps, please let us know how this community of practice can be helpful. It sounds like, you know, and in the chat, our colleague Linda shared her experience from Uganda. And, you know, I think many people outside the Save the Children family are really keenly interested in learning how this is going and how to really use these fantastic resources. So as you go into these next phases, it'd be great to hear what you would find valuable across this community. Perhaps, you know, if there are ways that people can help as you're providing new resources for piloting, et cetera. Thank you. I think you're on mute.
Sorry. Yeah, we are addressing also ableism and the disability stigma. But again, as I was saying, there's always the possibility to improve what we have done so far. So please, if you have good resources to share, we are very keen to address as much as possible. Also, maybe some areas that we haven't developed enough. So definitely, please share with me about about like the next steps and this wide community of practice. Actually, the learning agenda is led by me and another colleague who's not here at the moment, and he is actually the male colleague that is leading on the learning. And so my Serena will share with you also the email address of my colleague Prashan, and please get in touch with us, and we will also create maybe a side moment to have face-to-face meeting where you can share with us if you like to, and we would really love to create maybe a side moments where we can have face-to-face meeting and etc. Maybe we can also think of something more structured, and I would be very glad if also now having had the chance to be involved in this community of practice, if in the future, maybe in 6 months, we can have like a quick update or maybe something like that, would be super nice. Yeah.
Such a great idea. Thank you. That's wonderful. And thank you. Serena's already shared that contact information to your colleagues. So if others want to have a more specific conversation on the meal front, monitoring, evaluation, learning, et cetera, then please just let us know. We're happy to, and then you would be absolutely welcome back whenever you're ready. 6 months sounds great. Thank you. And if other questions, ideas keep coming up, please share those in the chat box. Let's continue the discussion. And with that, we're really delighted to hear next from Rolando Jr. Villamero, pardon me, the Regional Inclusive Education Specialist of HI for the Middle East. Rolando specifically covers Palestine, Egypt, Lebanon, and Egypt. And before his time with HI, with Humanity and Inclusion, he was the Inclusive Education Officer of UNICEF Kenya. He has both bachelor's and master's degrees in education and inclusive education. And he was a practicing elementary school teacher in the Philippines for more than 6 years. So we're really delighted to hear more about Rolando's work and this brand new, hot off the presses fact sheet, The Real Lives Behind the Data, Children with Disabilities in Education across Egypt, Jordan, Lebanon, and the occupied Palestinian territory. And we're really thrilled to welcome our friends with HI. Kudos to everybody who's been working on this new resource. Over to you, Rolando.
Hear me well?
Yes, absolutely, loud and clear.
Very much for the very warm introduction. And good afternoon, everyone. I'm joining all of you from Jerusalem, and I'm very happy to see my HI colleagues, Julia and Cassie, joining me in today. But I'm also happy to see friends and colleagues from the Middle East. I can see Mariam from INEE based in Lebanon. And we also have some friends and colleagues from Jordan and Syria. So I think the Middle East region is very well represented. So, and this discussion today, the brief sharing that I'm going to do about the fact sheet that you've just mentioned, Jennifer, is very relevant to the Middle Eastern context. And what I'm going to do in the next few minutes is just to share with the participants a few of the highlights of this very interesting and important piece of evidence about the experiences of children with disabilities in the Middle East. So we can go to the next slide. Of a context on how we developed this fact sheet and the rationale behind the importance of developing more data and evidence on disability inclusive education. I'm happy that Stuart in his presentation earlier keep highlighting the prevailing challenge of limited data and evidence on disability inclusion, especially in the context of education. And especially in the Middle Eastern region, availability of accessible information on disability inclusive education remains a challenge. So what this means is that if you are an education actor, like a local NGO or an international NGO, would like to know more about the disability inclusive education landscape in one country in the Middle East, it's actually gather and find data and evidence on the situation of disability inclusive education. It's either data are scarce, data are not available, and if data are available, they're very limited and they're very fragmented. So HI Middle East took the initiative of developing brief fact sheets to synthesize some of the critical data and evidence on disability inclusive education in 4 Middle Eastern countries. So we developed a fact sheet on disability inclusive education in Egypt, Palestine, one in Lebanon, and Jordan. The main intention of these fact sheets, so we call them country-focused fact sheets, as I mentioned, are to synthesize information about the situation of children with disabilities in countries in the Middle East about their access to disability inclusive education. Next slide. You'll see a screenshot of how the fact sheet looks like. So what you're seeing on the screen now is the fact sheet that we developed on disability inclusive education in Egypt. And how the document is structured is we first define inclusive education in the Egyptian context, and then we gathered all the data about how many persons with disabilities are there in Egypt. And then we also analyzed some of the available data as to how many children with disabilities have access to education. In the next 2 to 3 pages of the fact sheet, we also analyze some of the major barriers that children with disabilities face to include. And then at the end of the fact sheet, we provide some recommendations to stakeholders on how to promote disability inclusive education. And to those colleagues based in the Middle East who haven't seen or accessed these fact sheets, we highly encourage all of you to make use of this resource. This is available in the main fact sheet that I'll be presenting later on the lives behind the data. You can access these fact sheets, and I hope they're very helpful to your work on disability inclusive education in the Middle East. Next slide. And also globally started using the fact sheets from different countries, disseminated them to governments and actors. We reflected on the importance of to the data that we have. We've realized that while it is important to make education actors understand on the percentages, the rates of children with disabilities in education, what the barriers they're faced, we also reflected on the importance of really looking at real life experiences of these children. To ground the understanding of the challenges and experiences of children with disabilities in disability inclusive education. So as HI, we then took the initiative of developing a global fact sheet that synthesizes the data that we have from the country-focused fact sheets through real-life stories of children with disabilities in 4 Middle Eastern countries. So in this fact sheet, we highlighted 6 stories of 6 children with disabilities. We have 2 from Palestine, 1 from West Bank, and 1 from the Gaza Strip. We also have 1 story of a child from Lebanon. There's also 1 from Jordan, and we also have 1 from Egypt. Actually, 2 children with disabilities from Egypt. And again, the intention is to really humanize the data that we have on disability and to ground education actors on what the realities are of these children. Because oftentimes we're very much focused on strategic discussions, but missing out on the realities that children with disabilities continue to face for disability inclusive education. The fact sheet, the global fact sheet that we have right now is not so long. It's a very brief document. And because I come from a teaching background, I'm always tempted to use a little bit of active learning for a few minutes. So what we're going to do is, and I hope, Jennifer, I'm not disrupting the whole session, but it's just a very quick activity for people to have a look very quickly on the fact sheet if they've not done so. Krista will be sharing the link of the fact sheet in the chat box, or Jennifer, if you could do that for me, I would appreciate. Thanks, Stephanie. The next step is I'd like to invite each participant to click the link. Access of online, that would be fantastic. So click the report. And the next step is for you to skim through the fact sheet or report. Skimming through means a quick glance on some of the information of the fact sheet. What I would suggest you to do in skimming through the fact sheet is to choose a specific story that you're interested in. And to those participants from the session today who are interested in the Palestinian context, you can jump directly to pages 3 to 5, because we have of children with disabilities are those from Palestine, Gaza Strip, and West Bank. So if you're interested in the Palestinian context, you can go directly to pages 3 to 5. If you're interested in Egyptian context, then you can go directly to pages 6 to 7. More interested in the Lebanese context, then you can go to for Jordan context, you can go to page 8. And finally, if you're interested in the Lebanese context, you can have a look at the story of a child with disability on page 9. So just skim through, choose one particular story, and then we'll spend the next 2 minutes, just 2 minutes, we don't have to go beyond 2 minutes, to individually skim through some of these stories, and then we will be proceeding with the discussion. So Jennifer, if you could help me time 2 minutes and then we can proceed, I would appreciate it. That's okay for everyone.
Sounds good, thank you.
Are free to share their reactions to the chat box. So if you're reading one story, you're free to share your reactions, anything striking in the story, or maybe raise some questions that you might have from the story. Maybe you need some further information about the story. So feel free to share those information in the chat box. Left?
Yes, it's been about 2 minutes. Thank you.
Great. So thanks to everyone for your participation. I mean, the time is short, but I hope you were able to have a look at one story. And again, you're free to share your reactions in the chat box, and then we'll look into them when we have the Q&A session. So let's go to the last slide. Slide is just to present of you some of the critical reflections. And I could see a comment in the chat box about the whole issue of intersectionality, which is an important angle or lens in the stories of children with disabilities in the fact sheet. So what I'm going to do is to synthesize some of our critical reflections as HI from the fact sheet. And I would like to emphasize 3 analyses here or reflections. I'm looking at the first one, which is access to school of children with disabilities remains a significant challenge. And those in school struggle staying or are in special schools or centers. There's nothing surprising to this information. We know the challenges that children with disabilities continue to face. But I think the intention of highlighting again this one is to remind all of us that while it is true that progress has been made to provide disability inclusive education to children with disabilities on the ground, and the reality is a significant number of children with disabilities still have a hard time accessing education. And going to school is one issue. And I think you've read in the stories that a lot of children with disabilities in the Middle East have challenges physically accessing school. The lens here is children with disabilities who are in school, and I think all the 6 children with disabilities in the fact sheet, they're all in school. The challenge is they're not necessarily learning because the school system and the learning environment is not adapted to their needs. And if they are in the education system, a significant number of them are in special schools. And this has been highlighted in one of the stories, actually Malik's story in the Gaza Strip, where he was enrolled in a special school for so many years because of that thinking and perception that children with disabilities should only go to special school. To emphasize from these stories. The second reflection that HI would like to highlight is that, again, relating back to the issue of intersectionality, is that you'll see that multiple factors hinder children with disabilities from accessing education. So more specifically, these factors have something to do with gender, social norms associated with gender, and where children with disabilities live. So in the stories that you were reading, you would see that girls with disabilities oftentimes are more marginalized in accessing education. But it's not only girls with disabilities. From the experiences we have with HI Middle East, we also found out that boys with disabilities are also marginalized from accessing education. For instance, Syrian refugees in Jordan who are boys with disabilities are out of school usually because they're expected to work and they're expected to financially support their parents. So most of them are out of school. And where the children live, and a lot of the angles and lens that we're looking at here is the refugee situation, the migration situation of children with disabilities. So this is an important intersectionality that we'd like to highlight. Regardless, though, of all of these challenges that we see from the stories, reflect on the importance of support and accommodations. And again, this is an important recommendation that we need to be reminded of, that based on the stories in the fact sheet, it shows that support and accommodations, if they're in place, from caregivers to families to community to schools, children with disabilities can go to school, learn, and thrive. And this is what inclusive education is all about, is making sure that support and accommodations are in place in the school system so that children with disabilities can also thrive. So these are just some of the reflections that we have from the fact sheet, and I'm sure you'll have the opportunity to reflect more when you're able to read the entire fact sheet, especially the 6 stories from children with disabilities. Next slide. Support and accommodations. I just want to share to you this quote from Malik's father. Malik is a child with disability from the Gaza Strip, and his story is featured in the fact sheet. And speaking of the need for support and accommodations, this has been validated by Malik's father when he said, I think Malik could have a job when he becomes an adult if he can receive the needed learning support to succeed. Nothing is impossible. The future is open for Malik. We shouldn't limit the options for him. So with that, Jennifer, I'd like to end my sharing, and I hope these stories of children with disabilities will continue to remind us of the challenges that they continue to face and that we need to do more for disability inclusive education, not just globally, but also on the ground. So thanks very much for your attention. Jennifer, over to you.
This is terrific. You might see Rolando in the chat, just so many wonderful reflections. It looks like we have a question that has come in thanks to Hassan. Great fact sheet. Thank you, Rolando. It brings a major question to mind. How can intersectionality as a tool be more proactive in terms of serving children with disabilities? And then there's a reference to having a homogeneous framework in the context of Jordan. And thank you. It looks like colleagues have clarified that it's open source and everybody can access the fact sheet, but it looks like there was another question about consent to download the fact sheet. So maybe it would be helpful just to share any next steps, ways people can help Rolando with this work, sharing it on social media, sharing it with others. If there's anything else that the rest of us can do that would be useful to help distribute this far and wide, and any other aspects that you all think at Team HI would be coming up next in terms of usage for this great resource. Thank you.
Reflection and response on the question on intersectionality. What we do in the Middle East is we ensure that when the framework that we have really covers the different intersectionalities. So for HI, for instance, we're not only looking at disability, but we're also looking at the age and the gender components of children with disabilities, and ensuring that we look at the different intersections of these. So ensuring that this framework is robust, especially in mapping and identifying children with disabilities and providing support for them to go to school, is critical. And this fact sheet is actually available publicly, so anyone can make use of this fact sheet. The intention is really to disseminate this widely, bring this to your partners, have a conversation with this, use this as a tool to spark conversation with your governments. So this is the intention. This is open for everyone. Thanks, Jennifer.
Really well done. Thank you to everybody for your amazing work on this. And I know we just have a few short minutes left. Our colleague Nafisa, like we said at the top of the conversation, is traveling today. So she does send her warmest regards to everybody. We weren't sure if she'd be able to make it from Tanzania in time. So Stephanie and I and everybody else who's been involved with the work on disability inclusive education at the UN Transforming Education Summit, or TESS, and the call to action, please chime in. So we'll quickly share some of these resources, and then we would love to hear from all of you about any updates, announcements, things that you'd like to cover at future community of practice sessions. Next slide, please. So we were really thrilled to collaborate across the International Disability Alliance, the International Disability and Development Consortium, the Global Campaign for Education family, Perkins. Many of you who joined this effort are here joining us today in this discussion. So thank you for all of your work. This call to action is a focus on that. It was launched just a few weeks ago in New York at the Transforming Education Summit. And Stephanie did some fantastic research looking at that threshold of funding, but making the case for how important it is, and it is indeed possible, some countries are already moving in this direction, to progressively increase budgetary allocations for disability inclusive education towards being at least 5% of education budgets, and to set a medium to long-term target to ensure all learners with disabilities are reached in all education programs, recognizing that at least 10% of learners in any country will be learners with disabilities. And as we know from Stuart's presentation, the data is such that we need to continue to improve the data so we can better understand those needs right from the start. And to ensure all education programs and grants mainstream disability and include disability inclusion criteria and targets that really work throughout the entire program cycle, trying to move away from just a pilot here or there to full inclusion. Next slide, please. So many of you helped develop these great resources and are super familiar with the twin track approach. So, we're embedding in everything that we're doing, making sure that there's both investment in system-wide transformation and investment in the specific support needs of children with disabilities. And Rolando just referenced this as well, right, in terms of helping to make sure that special schools that do exist are a resource for moving to full inclusion. And we all know this from our own personal experiences, either as people with disabilities or having loved ones with disabilities throughout the life cycle. Next slide, please. Here are some great resources to support the call to action. If you haven't yet signed up, please take a look at it. Let us know if you have any questions. Daniela and others have wonderfully already started translating the call to action. So apologies that it wasn't available sooner, but it will be soon available in multiple languages as well. And we can share these direct links for people. The event that we held together included ministerial level speakers from Sierra Leone, with thanks to Casey and everybody at HI who made that happen, South Africa, USAID, UK, World Bank, UNICEF, and many others. So we've heard more about already today some of these resources. The Gender Responsive and Disability Inclusive Education Budget Toolkit was recently developed by ActionAid, Light for the World, the Global Campaign for Education, and others. Really terrific resource. And we're happy to delve more deeply into that or in a future conversation, and also answer any immediate questions people might have. Include Me, thank you to colleagues who shared that. It was developed by the International Council for the Education for Visually Impaired Members on supporting and encouraging children with disabilities to participate in home, community, and educational activities. And many of you were active in the development of the Freetown Manifesto for Gender Transformative Leadership in Education in partnership with UNGAI, with the UN Girls Education Initiative. And then the National Policy on Radical Inclusion in Schools. Many of you have heard Minister Sengay, who helped to lead with Amina Mohammed the entire Transforming Education Summit, and has spoken about that work developed by the Ministry of Basic and Senior Secondary Education in Sierra Leone. The bit.ly, the image on this slide, if you point a device or a camera on a smartphone to it, should take you directly to these resources for download, and you can also access these links directly in the slide deck. Next slide, please. So we would love everybody's help with signing, encouraging as many groups as possible to sign on to the Transforming Education for Disability Inclusion Call to Action for All Children by using this link or QR code. And I think it's being shared in the chat box as well. Thank you so much, Stephanie. Karina has wonderfully been adding everybody as organizations and individuals sign on. We have a handful of individuals who have signed on currently. If more individuals want to sign on, which you're welcome to do in addition to an organizational affiliation, a school, a government, a corporation, etc., it's open for everybody to sign on. Then we can really help to amplify this. We're also thinking together about key moments coming up. So if there's advocacy work or campaigning you or your colleagues are thinking about where this could be a helpful call to action, let's very much work together on that. We would love everybody's ideas, and please help continue to distribute this and encourage others to join this important effort as well. If you'd like to join a group that's working to advocate, to encourage governments and policymakers to endorse and sign on, or to share where they stand on these key areas to help accelerate progress, also please let us know. Next slide, please. Okay, and we've come to the end of our slide deck. Thank you so much, Krista. So with that, we would be happy to answer any questions you might have. We can also share, if you haven't received it, the direct links so that to the recording from that session where the call to action was launched. And we were really thrilled that USAID and the World Bank made a challenge to accelerate progress. Both had made previous commitments to work towards at the previous Global Disability Summits in 2018 and February 2022. The World Bank had committed by 2025 to have all education programming being fully disability inclusive. And Leanna Marr from USAID spoke about their commitment in February 2022 to ensure that all new education programming would fully use universal design for learning. So in the nature of the Transforming Education Summit, collectively we encouraged everybody to highlight new commitments, new progress, and new acceleration. And so we were really thrilled that USAID then said, well, let's challenge each other to see who can get to 100% first. And of course, quality as well as inclusive education are so key. There will be a follow-up conversation with USAID. We know there's a lot that's happening just today even, and they're speaking on some of their other work with FHI 360, Leonard Cheshire, and others. So if people are interested in joining that follow-up conversation to help make this more real, and then to work together to encourage other donors, governments, policymakers to join in this important work as well, please just let us know. Stephanie has shared that that meeting will be on the 9th of November and everybody's welcome, but it'd be great if you could email her so she can make sure that you get the information to join that conversation via Zoom. And then we are also really delighted to invite people to some upcoming community of practice and coalition meetings. So UNESCO, GEM report team, Light for the World, and others are holding on Monday a consultation on assistive technologies. The 2023 GEM report, or Global Education Monitoring Report, will focus on technology and education. And we know that from an inclusive education standpoint, there's such opportunity there to think about inclusive technology, assistive technologies, et cetera. So please join that conversation if you can. Share that with others that you think would be good to share, to provide input this Monday, the 10th of October, from 3 to 5 p.m. CET or SAST, with apologies to colleagues for whom that might be a holiday for Indigenous Peoples Day. But if you can spread the word or share inputs that you would like included, just let us know. And then we will be, we're delighted to ask everyone to save the date for the next Inclusive Education and Early Childhood Community of Practice meeting. We're looking at the 7th of December, same time as this one. And please register now and contact us directly with any ideas you have for speakers, topics, resources, projects, campaigns, advocacy to feature. That will be around the International Day of Persons with Disabilities. So if you all would like to join in and make it even bigger, co-sponsor that event and mobilization around that conversation together, we really welcome any and all ideas. And Krista, do you want to quickly share an invitation and key information about the next coalition meeting and later this month?
Sure, and I've just put that link in the chat as well. We are hosting and thank you to all, with the International Day of the Girl, a coalition meeting in honor of International Day of the Girl, which will be on Monday, the 17th, also in the same time period from 9 to 10:30 a.m. East Coast time in the US or in North America. So glad for you all to participate in that conversation. We'll have experts on girls' education in humanitarian contexts and settings, as well as an expert, hopefully with a more disability inclusion angle, speaking there. So please do join and participate. Thank you all for your wonderful work and for joining the conversation today.
Thank you, Krista. And please let us know if there are any other announcements or updates, information that people would like to share. But with that, please join us in thanking our presenters. We are so grateful to all of you for joining the conversation and sharing your fantastic work. We would love to hear from you regularly about your ideas for upcoming conversations and ways across this community of practice we can accelerate progress on inclusive education and early childhood topics right from the start. Huge thanks to all of you, and we look forward to connecting again soon. Thank you.